Hello everyone. In this talk we will cover two important topics, that is metabolic acidosis and metabolic alkalosis. Now, metabolic acidosis is an abnormal primary process leading to an increase in a fixed acid in the body. Now, if a patient has, say, respiratory alkalosis, and as a compensatory process there is an increase, the loss of bicarbonate, then we do not call that a compensated metabolic, we do not call that a respiratory alkalosis with metabolic acidosis, because it is not the primary process. There the primary process is a respiratory alkalosis. So only if it is a primary process, in that only we will call it as a metabolic acidosis. So abnormal primary process leading to an increase in fixed acid in the body, that is what is a metabolic acidosis. Now here there is a fall in plasma bicarbonate due to the titration of the bicarbonate by hydrogen ions. Hydrogen ions is a fixed acid. So wherever there is a disease process where there is an accumulation of hydrogen ion in the body, that hydrogen ion is titrated by the bicarbonate buffer, and because of that there is a drop in plasma bicarbonate, and this is the primary process, and this is what a metabolic acidosis is. Pathophysiologically, it can be due to an increase in fixed acids, or it can be due to a loss of base, for example through the kidney or through the bowels. So a loss of base can also lead on to a metabolic acidosis. However, the more common way of classifying a metabolic acidosis is in terms of the anion gap, whether the anion gap is high or normal. Wherever there is a metabolic acidosis along with the high anion gap, it is called as a high anion gap metabolic acidosis, and there are four primary reasons of high anion gap metabolic acidosis. One is keto acidosis. It could be a diabetic ketoacidosis, alcoholic ketoacidosis, or starvation ketoacidosis. In all these three areas there is an increase in keto acids in the body, and that is the fixed acid that is increasing. And then there is lactic acidosis. It can be either type A lactic acidosis, which is the most common one, basically related to anaerobic metabolism due to tissue hypoxia, or it could be type B lactic acidosis, which is because of an impaired carbohydrate metabolism, usually seen in patients with liver failure. Other reasons for a high anion gap metabolic acidosis, important reason is a uremic acidosis, which you find in patients with renal failure, where there is no excretion of the acid, there is no excretion of hydrogen ions, or it could be because of acute kidney injury, or it could be because of toxins, example ethylene glycol poisoning, methanol poisoning, in salicylate poisoning. Salicylate poisoning, there is an increase in acids because of the salicylate. At the same time, it can also cause hyperventilation, and that can lead on to a respiratory alkalosis as well.